The Consultant Interview, Career Exploration and Research. This short webinar will be specifically focusing on the importance of thorough career exploration in your preparation for consultant applications and interviews, and will be focusing on what to consider. How aware are you of what is important and fulfilling to you in terms of your career? What questions will inform your research? What to research? What information areas or relationships should you have knowledge, information, or awareness of in preparation for consultant posts? Where to research? Which reports, journals, websites should you be reading, and who should you be having conversations with? And finally, the pre-interview trust visit. So what do you need to clarify about roles of interest, and what will the panel expect you to have researched as part of your planning? As a starting point, consider your level of self-awareness. Adequate career exploration takes time and should always be informed by your self-awareness. What are your values, work preferences, strengths? How well will they be met in the roles you are considering? What knowledge, skills, experience do you need to develop if applicable? What will be the biggest challenges of the role, and how will you accommodate them? So what to research? What key information and relationships should you be aware of? Starting with the person specification and job description. What skills, experience and qualifications are required, and how does this match up with your self-awareness? Are there any subtleties in terms of communication and teamwork within this trust that you notice? And are there any skills that you need to acquire and develop to meet the job description? Key trust data. What is the trust's response to COVID, to Brexit? The latest CQC report. Who are the key personnel within the trust? What are their current budgets? What is the values, mission statement and strategy of the trust, and how well do you align to it? And how well is the trust currently meeting government targets? Some key questions to reflect on here could be, what values are honoured above all else by the trust you're applying to? What do they expect to see from their employees? How are you a good fit? And what examples do you have to demonstrate this fit? Key local data. Issues here could be particular issues pertaining to your specialty, the demographics, comorbidity, housing, employment, or mental health that are impacting on the services delivered by your trust. Research, teaching, audit opportunities and options at the trust. How do these compare with other specialties, trusts and departments you've considered? What links does your trust have with higher education and research bodies, and what opportunities may there be for funding, for research or teaching? Innovation and strategy, the bigger picture. What areas does the department or trust you're interested in do well? What are they innovative in or renowned for? For example, this could be service development or research areas. And where do they want to be in the future? And finally, culture. What is the general culture and politics of the trust you're interested in? Where does your department fit within this culture? What is the impact of the current trust strategy and targets on the workforce? And what is morale like? So where can you get the information to begin to answer some of these questions? What reports, articles and websites should you be researching? What events should you be attending? Who should you be talking to get informed opinion, knowledge of trust culture and politics? Starting with the NHS jobs. Obviously here you can find job description, person specification, trust strategy and values as part of the application pack. Next, look at trust reports values and the mission statement available on the Trust website. Key things to look at here would be the Trust Annual Report, board minutes, the CQC responses to COVID and Brexit. What examples can you give of aligning to Trust values and the mission statement? National strategy documents. Key documents and reports here could include the NHS Long-Term Plan for National Strategy, the NHS People Plan for National Targets, the NHS Improvement and Innovation and NHS Healthcare Leadership Model for Leadership Goals. Further links will be highlighted at the end of this webinar. Also look at Royal College news. What are the latest national and international innovations, projects and research in your specialism? How could this be accommodated within your trust strategy? What is the impact of COVID Brexit on your specialty? Networking. What experience do you have of the department trust of interest? Who is in your network that may be able to offer insight or introduce you to colleagues who can? What groups or organisations could be beneficial to join? For example, Royal College events, multi-professional research and audit groups, or LinkedIn groups. And finally, the trust visit. So what's the purpose of the trust visit? It's really to understand in more depth the context of the job and any politics, culture or hierarchies which may influence the department and post you're applying for in the foreseeable future. And this can include things like cost-saving targets, external competition, trust priorities, the trust views on the latest CQC report, and commissioning. Ultimately, this will enable you to provide more detailed and targeted answers at interview. The visit also allows opportunity to meet potential colleagues and members of the interview panel, making the interview less daunting on the day. So who should you meet? In terms of panel members, you should try and arrange meetings with the chief exec or his or her representative, the medical director, clinical director, consultants within the department you're interested in applying to, and the university representative. Also, you should consider meeting non-panel members to get a wider understanding of the culture and hierarchy of the trust and issues on the ground. Key people here could be senior nurse, midwife, the clinical theatre manager, the business manager, or the PCT rep. So what kind of questions should you be asking? These can cover a number of areas, but can include team expectations, development opportunities, department's place in trust politics, the trust financial situation and trust contribution, the impact of current reforms, and any negative publicity, poor reputations, or mergers on the horizon. What should you bring for the trust visit? It's always a good idea to bring a number of CVs, which you can hand to the delegates you are meeting to give them a wider understanding of your skills and experience. But also bring a copy of your application form, which you can refer to and highlight key experience and skills. And what homework preparation should you undertake before attending the trust visit? Make sure you are fully aware of the key contents of the job description and person specification for the role. Read up on the Trust Annual Report, the latest CQC report and the response of the Trust, and also any board meetings or PCT meeting minutes you can see. You can contact the PA of the Chief Exec or the link within the Trust specification details to get these reports and information. What about wider research on areas such as NHS strategy, clinical governance, and the possible implications of COVID or Brexit? We've already mentioned the NHS long-term plan and people plan, and also the healthcare leadership model and NHS improvement and innovation. But it would also be beneficial to look at other sites, such as the NHS Confederation, which has key information about Brexit, and also NHS Digital, which has key local demographic data. The NHS Employers website has key management information both nationally and locally. And finally, the King's Fund for key articles around specialty areas and NHS reforms. So next steps. So now you have a better idea of what to consider and research in terms of preparing for consultant applications, pre-interview visits and interviews. What are your next steps or key actions from what you have learned? What will you do and when will you do it? How motivated are you to undertake these actions? And who is in your network that can support you through this process? In summary, the more informed you are about the department or trust you are considering applying to, the easier it will be to both decide whether it can offer the opportunities, development and challenge you desire to elevate your career, but also have a greater understanding of how your strengths, qualities and experience match current and future department trust needs. This will in turn make your application and interview responses more targeted, knowledgeable and comprehensive. Further information and resources, including details of our regular Preparing for Consultant interview workshops, can be found on our website. Good luck.